Okay. Good day, good morning, good afternoon, good evening, depending on where you are. My name is Lavia Afuakwa. I'm with the National Development Planning Commission, Ghana. Prof, with your permission, if you're okay, we would like to start the program.
Good, Olivia.
Okay, a second, please. Okay, so as Dr. Festus mentioned, this session is being recorded. We are live on YouTube and Facebook, and we are glad that you invited others to join. For those of us online, just a bit of housekeeping. Kindly mute your mics to avoid any distractions as we hear the wonderful words from Prof. We are on all social media platforms, the African Center for Digital Healthcare Policy Research, on Facebook, Instagram, LinkedIn. You can kindly follow us on these platforms. So as I mentioned earlier, my name is Lovia Afuakwa. I'm with the National Development Planning Commission, Ghana. I'm a principal planning analyst and the resource mobilization and partnerships officer. I'm also a senior fellow at the African Center for Digital Healthcare Policy Research, and I'm very happy to be part of this roundtable, and also a pleasure to give the opening remarks. And so, Prof, as you may be aware, the KDI School of Public Policy and Management launched an alumni working partner program. I mean, it's actually done annually to accelerate positive development to shape the world and pioneer the future. And so it's good for us. The Africa Center for Digital Healthcare Policy Research has been selected as part of this alumni working partner program in March. Congratulations to us. And so we had a very successful roundtable discussion. I mean, we've had our first roundtable discussion, and the objectives were to discuss the challenges that adversely affect innovations in the digital healthcare space in Africa as a whole, like the whole Africa continent. And then the second, to highlight the way forward and specific policy changes urgently needed. And so now, today, we are going to narrow it down to country specific. So in this case, Namibia. And we want to highlight some of the health interventions and innovation regarding digital healthcare in Namibia and the lessons that can be drawn from it. And so we are very happy to have you on board. So to reduce health inequality, one of the empowered initiatives is to invest in digital health to make better health systems more effective and to provide universal health coverage. So digital health can bring the public health portals to provide transparent access to personal health records and contract with health systems. We also know that digital health can also bring equal opportunities for all through innovative and creative research and development. So for example, 5 teenage girls from Nigeria created an app called FD Detector that reads fake medications by coding and determining authenticity by using a medications barcode to authenticate and verify expiry dates of medicines. The digital health for achieving good care, good health and well-being and reducing poverty is a good initiative for all to work together from the ground, and especially to help achieve the 2030 agenda of the Sustainable Development Goals. So on the ground, digital health makes several pathways to deliver accessible and equitable healthcare services. And together we must harness this same agency and innovation to address the full range of challenges that we face in Africa. No one will do it for us, and It cannot wait. It must be us, and I mean, it must be now. We must tell our story as it is. We must learn from ourselves, peer learning from our fellow African countries. So with these few words, I welcome you, Prof, and I mean, wish us a fruitful discussion. Thank you very much.
Yes, thank you very much, Lovia. Of course, yes, we must tell our story, and I'm looking forward to tell the story.
Sure. Thank you very much, Prof. I am doubling as a moderator, and so I would now invite Maria. Maria, if you are on board, I welcome you to talk about the roundtable and to take over. Over, Maria.
Thank you, Lovia. Good day, good morning, good afternoon, everybody. Good day, Professor Daniel, and all the other colleagues from University of Namibia. Thank you for joining us. I would like to give an overview of this roundtable, which focuses on Namibia specifically. So Namibia is a country in Southwest Africa with an estimated population of 2.6 million. As with other African countries, the readiness of the health sector to be digital transformed is low when compared to global standards. The acknowledgement of this in July 2021 by President Hage Geingob demonstrates the consciousness of the government to request for support nationally by preparing a team to evaluate Namibia's readiness for the fourth industrial revolution. Given the foregoing, it's important to highlight efforts by academia, industry experts, and government agencies on how the health sector can appropriately develop in artificial intelligence, machine and deep learning, smart devices, amongst others, to improve health outcomes for Namibians. While there are questions about readiness, while there are questions about readiness, capacity, and affordability, the conversation around the evaluating of relevance of digital health innovation must continue, hence the needs for this roundtable. So we are looking at 2 to 3 roundtables objectives for this session. Number 1, to comprehend readiness for digital health transformation in Namibia. Number 2, to highlight the efforts by stakeholders and intersection of these efforts. Number 3, to comprehend the views by Namibians as to clarity on government digital health policy in 3 tiers. The 3 tiers are as follows: the preparedness, the capacity, and the affordability. So after this roundtable session, we are looking at the expected outcome of this session, which is the preparedness report for digital health transformation in Namibia. Thank you, Rovia. I hand over to you. Rovia.
Oh, I'm sorry, I was muted. I was talking at the same time. Yeah, thank you very much. Thank you so much, Maria, for that overview and the objectives of the roundtable. So we are now going to move into the discussions, and I can't wait to hear Prof's position. And so we will start with Tony.
Okay, hello everyone. Good evening, good morning, good afternoon, wherever you are. My name is Jesu Tony Ajiboye from Nigeria. I'm also a research fellow at the center. Just before we get into the conversation, I would just like to read a brief profile of our guest speaker. Professor Daniel Likius is the head of Science and Technology Division, Multidisciplinary Research Service at the University of Namibia. He holds the ASSAF, TWAS, AAAS Regional Fellowship for Science Diplomacy. He received the National Sustainable Development Award from Environmental Investment Fund's Research and Development Award 2021. and the Best Research Excellence UNAM Award in 2018. Professor Daniel completed his PhD in Applied Chemistry and Chemical Engineering at Kogakuin University, Tokyo, Japan. He also holds a PDHE, PDBA, BSc, and MSc in Applied Chemistry. His research interests lie in materials for renewable energy, ranging from theory to design and implementation. He has collaborated actively with researchers in several other disciplines of chemistry, particularly inorganic and computational chemistry, as well as in components of digital health, innovation, and digital ecosystems that are important in the administration and delivery of healthcare services. Professor Daniel Likius, you're welcome. We are honored to have you. And I would be handing over to Maria to start the question session. Just to add that in case any of the attendees may have any questions as well, please type them in the chat box and we would be sure to ask them along. Thank you very much.
Thank you so much, Tony, for that. So for now, I would like to welcome, I would like to ask our guest speaker, Professor Daniel, some of the following questions. So Professor Daniel, are you ready?
Yes, Maria, thank you.
Okay, Professor. So Professor Daniel, according to the Health Minister, Dr. Shangula, Namibia's special medical records are largely paper-based, making the verification process lengthy and bulky. The Health Ministry launched a national e-health strategy responding to quality health and social services. So, Prof, how do you perceive the readiness for digital health transformation in Namibia?
Yeah, thank you, Maria. Thanks. Also, let me thank Dr. Festus, Tony. Thank you, and also in general to the African Center for Digital Health Policy research teams for the invitations. And before I answer your questions, let me first express my gratitude and appreciations for Tony to introduce me to the audience. I'm greatly honored to have been invited to participate in this roundtable meeting. Thanks to the technology, and nowadays we can be able to interact from a distance, as you can see it now here. Otherwise, I could be maybe in the UK or somewhere together in Nigeria or Ghana to do this presentation or these discussions. Although I'm not much involved in health sectors, so I'm an academic, I know I'm at the right place, of course, at the right time to discuss this. As you mentioned in the introduction, actually, Tony, I'm currently heading the Science and Technology Division in Multidisciplinary Research Service Unit under the Center for Research Services of the University of Namibia. So at my office, I'm overseeing and effectively coordinate of research tasks in the 6 themes. And those themes now is about, we look at, or I coordinate research under applying agriculture and conservations. And also we look at the biotechnology division and engineering and sustainable material, energy and also water, as well as we are looking also to indigenous knowledge and also, of course, medicine. So this field, of course, this topic fell under my divisions, the Science and Technology Division of the University of Namibia. And that's why you are seeing me here also, of course, participating in these topics. Moreover, I'm also trained as a science diplomat. So I'm a science diplomat. And this is, I'm fairly under the field of what we call science diplomacy. So in science diplomacy, I can define it like it's a fast-growing field of research, which look at research, education, and practice dedicated to understanding the reinforcement and the connection between science and technology and internal affairs to tackle national and global challenge. That's why today also you see this topic is very relevant and it's very important for me to discuss it in either in the context of my position as a coordinator for science and technology here at University of Namibia, and also in the context of science diplomacy. So back to your question, maybe I have to answer. Yes, of course, the national, there is a national e-energy strategy provided a fundamental element of digital health for Namibia by 2025 to position to position the health sector to enhance the efficiency and the effectiveness and its operations. Yeah. So the fundamental elements for analysis of the readiness of Namibia toward a digital health transformation can be done, and I can analyze it using 5 pillars according to the World Bank. They have set up the 5 pillars. But if I want to answer your question, then I will look at the first and second pillar only, where it is looked at. If you want to see the readiness of Namibia or any country in terms of a digital readiness, then we look at for instance, if the availability of telecommunication, electrical services, and network infrastructure. So that is very, very important to look at. That means wide access to telecommunication, the availability of electricity, and reliable network coverage are any important vehicle to drive the agenda for digital transformation, especially in this context of health and social services. In Namibia context itself now, because we are now looking at Namibia, I can say that Namibia has been already working towards harmonizing various policies. They've been harmonizing various policies and initiatives into a single national ICT, information and communication technology policy. And our 5th National Development Plan, the NTP5, for the period in the range of 2018 to 2020, outline its vision of Namibia with a knowledge economy and the universal access to information, affordable communication, and technology infrastructure and services by the end of this year. So we are already having that in plan in the context of the policy. And I can also inform you that the country specifically aimed at having 90, for this year, have 90% of its population covered by the broadband infrastructure. But if I can tell you how this is moving, for instance, by the end of this year, we're supposed to have about 20% of coverage. But if you look at 2015, it was only about 21% of the internet coverage in Namibia. So we are getting ready to that. So that's, you can say. And then moreover, I can tell you also that the second pillar of is looking at the public and private digital platforms, how the private sectors and the private individuals have bringing or create a platform for digital transformations. So based on my own assessment on this pillar, I can tell that in Namibia context, it indicates that Namibia is made and can create a strength in digital transformations. For instance, I can tell that the hospitals such as Central and the Oshakati, we have a Central Hospital here in Windhoek, and in the north we have a Oshakati Hospital, have been significantly improved in the digital spheres, and have largely moved from using paper-based to digitals. So that's the current things that we are experiencing here toward the digital transformations. Equally, I can tell also investment in digital transformation to reduce manual processes in hospital and clinic will, of course, eventually lead to the fast, effective service delivery. So that's the advantage of if we can have a digital transformation in Namibia here in the health sections. Okay, for instance, imagine a woman in a remote setting or remote area need to return to the nearest health facility or clinic to follow up a treatment. And for now, it could be easily if she can now be able to receive a reminder on just a cell phone. And then it know that, oh, he need to go and get his medications. because usually you sometimes the local nurse have to travel distance just to remind the patients about their medications. But if you can do it that digitally, then that could be the advantage. Or for instance, a patient needs the next prescribe of his higher blood pressure medications, and she can now receive by just an email or a short SMS without the physical conduct of a health facility. So that it will be very good. So, and then although this may seem small, for instance, those two examples I gave, it makes a difference in improving equitability, access to healthcare and to remote or underserved community without any financial arrangements, you know. So despite those several opportunities that I mentioned, if explored correctly, we could explore digital transformation in Namibia. Let me tell you how we are almost there toward that, just based on your questions. I can tell that the Namibia is access to what we call a WACS, cable, as well as we expect now by July to be connected to Equator, or what they call it Equino cable, which will put the country at the highest level of digital infrastructures. So the investment in the Equator cable, which is under the sea, Equator cable capacity means that the service providers, such as MTC here in Namibia, TN mobiles, and the apparatus will be able to offer Namibian any international internet capacity. See, such a needed diversified route at a cheap price. Because if we get if we add Equator cable to WACS, the price for internet will be lower. And then also, if we look at and this will enable the regulator environment, such as health, health EF strategy to foster more health services in need for health sector to realize the energy benefits that we need to consider. So with that also, despite the opportunity like the cable connection and so on, there are some challenges that are limiting the digital transformation in Namibia and prevent Namibia to realize the implementation of national health EF strategy plans. If we are not addressing them, then we will not realize that transformations. So for Namibia to be ready, I can tell that the lack of modern infrastructures, especially electricity supply and limited internet access in rural area and in remote area must be fully addressed. That's the very important part. And then this will help like manual processing of the health created a challenge toward aspiration of digital health transformation, because most of the hospitals currently, they are still using the manual paper-based, as you mentioned in your question, to deal with the health things and so on. So we need to go digital. For Namibia to be more ready now, I can say that Namibia need to expedite the adaptation of the digital transformation from both, either from the private and public perspective, to reach the aspiration of the second Alambe Prosperity Plan, because Alambe Prosperity Plan have highlighted this transformation already. And then I can tell also that one of the strategy to achieve these goals is to having a digital technology integrated into all the sector economies, which particular additions can be given to, for instance, already we can see from e-business, like what Bank of Namibia have gone through that already, integrated that through the stakeholder like the banks. And also we can look at the e-learning. Of course, our university have done based on that. The other institutions also are following that suit. And then we can also to see the e-government, there's e-governance, and the government have done that already, especially on the procurement and other activity in the government. So those are the very important things. But main important is to achieve all this. is to upgrading the national digital infrastructures, build new network transmitters across the country, especially in the rural area. And then we can also do implementing different measures to ensure everyone can be able to afford internet access, as well as establish the connectivity in rural area. Are some of the strategy that we can consider or outlined by the country toward achieve digital transformations. Yeah. Okay. With that, there's a need to accelerate what I have just mentioned. For instance, also we need to sharing data sharing, and also finally, for Namibia must be ready to prepare itself for the fourth industrial revolutions. Thank you, Maria.
Thank you so much, Professor Daniel. That was some insightful inputs, and we really appreciate that. Moving on to the next question, we know Professor interacts, or to say engage with a lot of stakeholders from different sectors. The second question is that we would like to find out from Professor, is Professor aware of key stakeholders that matter in the transformation of the health sector in Namibia? Can Professor highlight how does these stakeholders interact?
Yeah, thank you again. It is indeed a good question that most of the interviewers forget to ask, especially in context of stakeholder. Okay, you know, Maria, you know, the main objective of digital transformation strategy is to improve the delivery of service to stakeholders. So that's why I'm saying it's a good question. And the stakeholder, when you talk about stakeholder, we have to consider both internally and the external stakeholders. By leveraging the technologies and the digital evolution or innovations. So that means several stakeholders in Namibia context are already identified. And I follow up a paper by Iwaya. I think he's now a doctor. He was studying in Stellenbosch. I think he have already did some review on stakeholder in terms of digital transformation in Namibia. And here in now, for me, I'm not going to mention specifically the name of those stakeholders, just to the same way I'm not going to mention, you know, the main stakeholder here is the patients. And I'm not going to mention the patient who is our stakeholders. So I will make it more general. For instance, you know, the key stakeholder for EF is mainly the patients, you know. And then also the other stakeholders, main stakeholder is the professional from various disciplines, as well as the service providers, the government institutions, of course, research institutions and the innovation company. All those are the stakeholders in general. So if you are feeling that, you know, you are from professional field, or you are a service provider, like maybe you are emergency, you are in the field of emergency, driving ambulance, those are stakeholders. And then patients are more considerable relevant to the digital in context of digital health services. Patients are more considered on this. And then also professionals such as researchers, like myself, a researcher, they say the IT professionals and medical doctors or medical practitioners will actively take part in the digital health. So they are stakeholders. Every stakeholders in this will play a role within the ecosystem in a domain of their expertise. For instance, a medical doctor, I can say they are stakeholder, and the medical doctor will perform healthcare delivery related to activity using digital health technologies, such as what we call telemedicine, and the one they mention here, they say FD detectors and so FD detectors that I just hearing from Ghana, or that's happening, the apps that's happening created in Nigeria. So and so the interaction with the patient in the digital ecosystem will be enhanced in such a way. If the medical doctor will perform a healthcare delivery, activity using a digital health technology such as those apps. And then using the apps like telemedicine, a doctor can consult with a patient who resided or lives in a distant locations. And then if we look at the health institution also as a stakeholder, the health institution like an hospital can provide a support by sharing information with other institutions to reach agreement regarding the use of healthcare resources for delivery of healthcare services. You know what I mean? Like two hospitals, they have come up with a good strategy of preventing a disease, or come up with, they can share information or medicine by just looking at through the service, through the service, okay? And for instance, imagine a emergency service provider. Emergency service provider, like people driving ambulance who come to the scan when there's an accident, are example of stakeholders. So imagine if any emergency service provider come at a car accident or vehicle accident to attend to the person involved in the accident. Once he got the ID, once he got his the ID of the person involved in the accident and scan it, he can be able to get a medical history of such a patient, and then as well as some relevant information, for instance, the blood groups and so on. So he can quickly be able to do, for instance, blood transfusion and save a life in a quick way. So that's the advantage, and that's I can say those are the stakeholders. And then also, when it comes to researchers and academians at the academic level, researchers and academics can conduct research which will lead to innovations, like creating new apps in special from IT technology divisions, and then also can come up with new idea which can promote innovation in the delivery of healthcare service. This goes along to the contribution to the fourth industrial revolutions. So with that, I can say IT professionals are potential, actually a stakeholder, and the IT professional take part in the ecosystem, can provide technology support of various technology deploys. In the other stakeholder as like actually the non-governmental organizations like WHO. So for instance, in order to meet the demand of effectively e-healthing or digital health transformations, healthcare policy makers, such as the Ministry of Health and Social Science and the non-governmental organization, need to understand the potential stakeholder and perceive the benefit of a digital health service. So that's, I think I have just answered your question. I try to if I can summarize it, to list the potential, actually the stakeholder in this scenario and how they can be benefited or contribute to digital health transformations. Yeah, right.
Thank you so much, Professor Daniel. That was quite an impressive input. We really appreciate that. I pick up a point that you mentioned that the WHOs and the NGOs such as WHO needs to understand the potential stakeholder and perceived the benefit of digital health service. So my next question is based on the atmosphere, how is Namibia prepared? But according to the World Health Assembly, WHA, of 2013, they urged member states to introduce ICT in the health sector and provide an enabling environment for its usage as e-health. On the other hand, in 2021, Dr. Charles Moses, the World Health Organization representative to Namibia, has stated the implementation of e-health within the public sector of Namibia, that it has great potential to support the provision of quality health services and contribute to the achievement of universal health coverage. In terms of Namibia, according to you, Professor, how is the atmosphere like for Namibians in terms of preparedness, capacity, and the affordability of potential digital health solutions?
Thank you for the questions. I think it's still a good question because we are looking how ready we are. What is the capacity available and how can we afford the chance of coming up with a potential digital health solutions? Yeah, thanks. Yeah, I think digital transformation has been recognized in most of the Namibian national documents, as far as I can tell. For the national document, maybe I mean document like Vision 2030, NDP, now NDP 5, and then the second Alambe Prosperity Plans and other documents. And these documents are any enabler to economic growth, of course. So the Namibia government's Vision 2030 document stipulated that ICT must be the most important sector in economic development of the country by 2030. So that's what it's mean in the context of ICT. And we are moving toward that, as I mentioned before, that yes, we have things in place that are moving toward that. As much Namibia implemented any information, communication, and technology policy, of course, since 2008 and 4, Namibia have already established ICT policy, and it was reviewed or improved in 2008. And then also, so that means this policy is already in place. And then if we look, we're showing that we are prepared. And then also, according to CRAN, last year, they reported that the population coverage for Namibia stood at 89% by June last year. By June last year, we were already at 89%. And the government has any ambitions of, the broad policy aim to provide 95% population covered by 2024. So all those are showing that we are prepared for the transformation. And the policy also aim to, the brand ban policy is aimed to expand electricity supply infrastructure to rural area to enable internet routers and modern devices to be switched on along the crops. Currently, if you go deep into the village, it's likely that your internet road may not working because there is a lack of internet. So the supply of electricity could be one of the things, the main problem. Although we can have two things, you might have the electricity, but there is no internet. So those infrastructure must put in place, and the policy stipulated that. That means that since June 2004. Namibia has been preparing for this transformation, and the NDP, National Development Goals, not NDP, but NDG, the National Development Goal has been formulated within the context of Vision 2030. The NDP, of course, have been, so the country specifically aimed at having, let's say, is aiming to have 90% of its population covered by broadband infrastructure by the end of this year. And this takes us that we are moving, because in 2015, it was only about 21%. And it was only 21% of the coverage in of the internet on electricity in Namibia. In terms of capacity and affordability, I try to use the World Bank diagnostic tools and the guideline based on the maturity of economy to analyze the Namibia digital health transformation achievement so far. Because your question is the capacity and the affordability. So I'm going to use the World Bank diagnostic to present it to you here on how to see if we are ready for that or we have the capacity. So what I can tell you is that the absence of reliable, as I mentioned, and the secure higher speed network and data entries data centers in all corners of the country could run to an incomplete digital health transitions. So that could be the loophole if we are not covered with a higher speed internet all over the country. But for so far, I can say Namibia is doing well so far in the context of digital infrastructure. We have access to undersea internet, as I mentioned, cables. We have advanced in 4G and 5G network, and progressing well with rural connectivity. We can be able to download, even here in Wind, we can be able to download mobile apps from either Apple Store or Google Store, and we can use most of the software-enabled platforms. We can do that for any cell phone. Okay, and basic digital payments, we can do basic digital payments. You can do person-to-person payment using e-wallet, Blue Wallet, Easy Wallet, or what they call it. It can be done in Namibia. So that's showing the progress that we can we have the capacity. And since 2015, the total number of active SIM card rose by 14% to 2.9 million. You know, our population is just about 2.6 million, and we have about 2.9 SIM card, registered SIM card in Namibia. This statistically present a wide usage of mobile phone in the country. That means a lot of people are using mobile phone. So that means it will not be difficult to connect people and to go health service. You can do that because a lot of people, obviously, they are having cell phone. Mobile phone are already considered the cornerstone in driving toward any affordable health services. So as long as we know that people are having a cell phone and we are connected, there's internet all over the country, we can easily go e-health. And then, however, it's hard to hearing about bootcamp and digital skill training in Namibia. You know, the main thing here is now, look, people are having cell phone, but we don't know if they can be able to use like the FD detectors apps. We don't know if they can use telemedicinal apps to do digital health, you know, transformation. We don't know that because so far I had hearing like boot camps or digital skill training in Namibia, especially to most of the people may not know how to use the apples except for calling and texting. So strengthening digital capacity building must be considered as a way forward, especially we have already NCLST, which is mandate or may be coming, which may be able to facilitate the training for the normal person to know how to use apps. Then that's the way forward. Then that means we will have the capacity and able to go digital. Yeah, thank you.
Oh, wow. Thank you, Professor. I think the session is getting interesting and knowing more about Namibia and all that. Thanks to my colleague and all that. We have so many questions for you, Professor. Based on your knowledge, skills, and competence for professionals to support healthcare through digital transformation in Namibia, are there startups that are dedicated to provide, medical and healthcare solutions holding technology in Namibia?
Of course, yes, there is a startup already in place, colleagues and fellows. There is a startup. Let's say last year, the Ministry of Health and Social Science introduced what we call an integrated healthcare information management system, which is also on, we call it here a e-health system of Namibia. This is a web-based and cover all aspects of hospital management and day-to-day operation of the hospital. So we have that system already in place. And that this health e-health system, all patients will be allocated a unique medical health record number. Yeah, a medical health record number, which can be used across, we have about 34 state hospitals in Namibia. And it will eliminate the need for the patient to carry medical passport or treatment records. So the system should have replaced all manual procedures, and the system in the hospital aim for paperless hospitals. So there will be no more medical cards and other paper-based documents. So the ministry has decided to go for any off-the-shelf product, and they are busy with the tendering process. So everything is already in place. We are there. We are starting up. There's a start up already in place, and this strategy is aligned to the WHO global strategy on digital health, which is targeting 2020 to 2025, because it's also stipulated in that documents. And the development of strategy for Namibia was also supported by, of course, by WHO and other partners such as the Indian government. Have donated some grants to Namibia for this tendering of the implementation of the health care information management system. And the HWO also, I can say, is committed to provide ongoing support during this implementation. So there is a startup. And the Ministry of Health recently advertised a tender for the supply of computer equipment for hospital in Oshakati, Rundu, Ketmanshop, and in Windhoek as part of the implementation of ES system. So there is indeed a startup that are dedicated to provide the medical and healthcare solution holding technology in Namibia. So that's the one. We are there.
Thank you very much, Professor, for the insight so far. I must say I've learned a lot, and particularly the interesting one I just heard was the information management system you mentioned, and it's interesting. I would be taking just a few questions, but first I would like to ask regarding how we've seen the e-health solutions used in COVID-19, being used to manage patients and the demand around that. Can you highlight to us if there is a way we can access information or a database on startups that work in the health tech sector in Namibia? Because here in Nigeria, we have things like that, and we are able to track information on what they're doing. So I would like to know what you think about how e-health has been used to solve the COVID-19 pandemic, and how startups are helping as well.
Okay, thank you, Tony, for the questions. I think the emergence of the COVID-19 pandemics has led to a surge in digital transformation, ranging from electronic commerce, or what we call e-commerce. You also familiar with the current popular one, digital payment method, which can also happen at, for instance, at our health institutions, at the hospitals. You can pay your bills using the digital payment methods, and the provision of electronic services, which we call e-services, from both the public and the private sectors. So that's happening also, of course, here in Namibia. So that means digital transformation ultimately led to digital health, whereby manual process of data are improved or replaced by digital technology. So I mean now the health system that I mentioned already seem to be the one that is currently providing assembly, analysis, and disseminations of data necessary to guide and promote and evaluate the disease preventions and health promotion program. So I mean that the data about incidence and mortality of diseases such as COVID-19 infection the trends, the identifications, and the prevalence of risk factor is currently shared between the health e-health system in Namibia. So that is, the health system is working. That's why you can tell how the number of people infected, and the minister himself can get that information to present it to the community, the newspaper can get the information. That's mainly because of the availability, the working of health system of Namibia. Yeah. Thank you, Tony.
Thank you very much, Professor. I have really learned a lot. Maria, do you have any more things you want to add?
No, Tony, I think that's all the questions that we have for today. Thanks a lot to Professor. Maybe we have learned a lot from Professor, but perhaps Professor has something else to add before we do the closing remark and all that, or before we allow other participants to ask questions, maybe?
Okay. Thank you, Maria. Maybe I can say, yeah, the last question was I mentioned about the COVID-19, and this can tell us that the pandemic has not only changed the world, you know, things like COVID-19, it's not only changed the world, but it also has exposed the weakness in national, global institutions and international cooperations. It has actually brought the world to any unprecedented heights. The pandemic does not respect borders, nor the status of the country as a developed or a developing country. However, we have to accept that due to the level of development, African countries, including Namibia now, feel more the impact of pandemic. Hence, it's a call from Africa us to change the course and to develop a strategy to speed up the implementation of the continental development agenda. You know, we have a continental development agenda, namely Agenda 2063. And then also we have the African Continental Free Trade Area. So the development of Africa is determined by what is happening in individual member states. Therefore, Namibia is to play a part. And if digital transformation is the way to go, we must embrace it. And that's the way forward. Yes, we must do it. Thank you.
Wow, thank you so much, Prof. Thank you, thank you. I can't believe I was just enjoying the conversation and all that you were saying. And I wish that you are going on and on and on. I didn't want you to finish because I was really enjoying it. You said a lot, and I mean, we've also learned a lot. And what I'm more fascinated or happy about is the strategy that you have. I think it's something that others or other countries can emulate. We need to have a strategy. We can't just go like that. We need to really have a strategy, and it's something that I'm really happy about. So thank you so much, Prof. I know we are going to continue this conversation because we can't end it just like that. We must continue.
Yes, must continue.
Yeah. And so I just want to thank everyone on board, everyone on the call. We really appreciate your participation. And so we want to give opportunity to ask questions. If any of the participants have any question for Prof, any burning issue, any contribution or comment regarding all that Prof has said, kindly, this is an opportunity to do so. We are giving few minutes for that. If any of us on the call has any comments or questions for Prof, you can do so now. Prof is very busy, and so now that we have him here, let us take the chance or the opportunity to ask the questions that's So, Prof, with your permission, let's just give participants a few minutes.
Yeah, please. And maybe we'll check on the chat if there is any question or just a compliment or comment. Yeah.
Yes, Prof, if I may, just before any other attendees ask the question, I find the health information system that Namibia does very interesting. And I would like to learn more, definitely. I don't think Nigeria, I'm speaking from Nigeria at the moment, and I don't think Nigeria has something like that, a central database. You were speaking to how first responders may be able to get the blood group, other relevant information of a particular person involved in an accident, and how it can really save the life of the person. So is there a way maybe Nigeria can adopt that policy? What would be your advice to other African countries about how they can improve on their digital health solutions or using technology from the Namibian system?
Okay, yeah, thank you, Tony. Yeah, of course, there is a way. Usually we learn. Currently what Namibia have is now the strategic or the policies in place, but there is now how to do the implementations. So with that, usually it's a good way of benchmarking. Benchmarking sounds once you set up your team correctly, and of course Namibia can be a space, can provide a space for you to learn from them. And then also, for instance, bring in any other a member from Namibia to join your committee, and then work together, or come and visit Namibia, come and visit the Ministry of Health and Social Science, Social Services, and see how they came up with that strategy, and then look over and then incorporate it in your context, in Nigerian context. Yeah.
Thank you, Professor.
Okay, so I think there is one in the chat box. Yeah, indeed, it's a great section. So we have one from Osman. He said, aside the infrastructure plans, do you have any plans to develop the capacities of staff in amid the advance of digital health?
Yeah, okay. Thank you for the questions. I think I can mention who sent it from Osman.
Yes.
Yeah. So of course, yes, we have the infrastructure plans, but so far, for in the context of capacity buildings, I think that's a good questions, and that's why I'm saying I have never held training, things like boot camp, and maybe I just skip. I didn't get that information, but it's saying that usually the capacity can be done by short course or short training to the people in, especially the nurses in the hospital, and also the people, the general community, to be trained on capacity building. You know, so far I cannot say there is some training here, but usually people take it as like people know already. As long as you have a cell phone, even if I ask you that, how did you learn Facebook? There was no such a training. You just happen to get to see how people are doing it, and then come up. Maybe they follow it in that way. But if I really go through deep into the strategy, or through the strategic plan of the EF system, maybe there's a part which are also reflecting on the training.
Okay. All right. Thank you so much, Prof. Is there any other comments or questions? Before any other person come in, Prof, we are very grateful, and I mean, we've learned a lot. We are going to put all that you've said into a policy brief, and we are going to share with KDI School, and I mean, it is also going to be on our platform, on our website. So you can check on our website, the African Center for Digital Healthcare Policy Research, after everything is put together, we will put it there for future reference. Okay, so thank you, Dr. Festus. We just put the website in the chat box, so you can follow us for policy briefs that we are going to put there, future events and future roundtables that we are going to have. So we can assure you that, I mean, we are going to put that together for a good use. Thank you. Is there any other? If there is no other, maybe I would invite Dr. Adedoyin to give us the closing remarks, and I mean, the closing remarks here, and a few highlights of what Prof said.
Thank you. Thank
I
you
know
very
I
much.
always put you in a tight corner. Forgive me.
That's all right. Thank you. Thank you very much, Lavia. Thank you. Thank you very much. Thank you very much, Professor Daniel, for this very interesting session. You have really dug deep into the details of digital health policy in Namibia. Not many people know a lot about Namibia. And when you mention Africa, people think of South Africa or Nigeria or Ghana, or especially in sub-Saharan Africa. So it's important to really bring Namibia into the world view, especially with all the many good things happening in Namibia. For example, this policy and the approach to managing the COVID-19 crisis. Some people argue that you have very small population and it's easy to manage, but it's not true. Whether large population, small population, it's all about making good policies to look after people. After all, we have states, local governments, regions, and it's all about having the right tools in place. And it's good to really listen to you, Professor Daniel. You're very experienced in this area, and we are very privileged to listen to you. We're looking forward to working with you more, Professor Daniel, and more in even advisory capacity, and going forward into our programs in the future. So thank you very much, Professor Daniel, once again, and thank you very much to all our participants who have joined us today. Thank you very much for our colleagues from the University of Namibia and to the team at ACDHPR. Thank you very much for putting all this together. As Lavia mentioned, we will have the policy brief ready in some weeks' time. And we are partnering with our university in South Korea to work towards achieving SDG 3. So this center is really heavily focused more on SDG 3, which is good health and well-being for everybody. So we're looking forward to ensuring that this is achieved, particularly in Africa. So thank you very much. Thank you, Atik Rahman, for sharing that information. Digital health journals can also contribute to development of the health sector. I'm not aware of any current digital health policy journal, so that's a good idea for us as well as a center in the future, to have our own academic journal towards that. So thank you very much, everyone. In the absence of any more, Atik, you want to say something?
Yeah. Thank you, Mr. Fidus, for acknowledging that. Thanks, Professor Daniel, and thanks to all for giving this opportunity to participate in this. Yeah, thank you.
Thank you. Thank you very much. I think we'll just leave the floor open if anybody wants to say anything, and then we could close the session. Thank you very much.
Okay, thank you. Thank you so much.
You're muted, Professor Daniel. I think Professor Daniel is saying something, but he's muted.
Oh, no. Yeah, I was just thanking you, Dr. Festus. Thank you very much. I wish you any enjoyable and productive afternoon ahead, and everybody, thank you.
Thank you. Okay. Over to you, Lavia.
Okay, all right. Thank you so much, Prof, once again for the insightful section and session. We are very grateful, and like Doc mentioned, we are going to, call on you more and to have more of these sections. Thank you so much. And thank you all our participants. We are very grateful for your presence. Shall we all give Prof a virtual clap?
Yeah.
Thank you so much, Prof. We are very grateful.
Thank you.
Okay, so we have formally come to drawn the curtains. We are coming to the end of. Thank you, Rosemary. Thank you.
Thank you. Thank you.
For joining us. We are very grateful. So we have formally come to the end of the section. So the rest is very informal. Any question or anything that you want to say is off record. So if you have anything to say or to Prof or to any of us, I mean, you can just do so. Thank you.
Thank you. Okay, I have to log off now. I have another things to do. Thank you.
Sure.
Bye.
Thank you.
Thank you,
Thank you very
Professor.
much.
Bye.
Bye, everyone. Thank you. Bye.
Bye. Bye.